here is a case scenario. A 50-year-old female presented with white crystals on the skin, and she is also complaining of fatigue, vomiting, and confusion. And also, she is a known case of chronic hypertension who is on irregular medication. What is your diagnosis? And this is the picture of the skin lesion of the patient. You can see the white crystals on the skin or all over the limbs. So before looking into the investigations of the patient, we should narrow down the diagnosis to a particular system, keeping the history in our mind. So here the patient has fatigue, vomiting, and confusion, and she is a known case of chronic hypertension. So when we see chronic hypertension in a case scenario, we should definitely think of something related to kidney. So in chronic hypertension, both kidney and heart will be affected, but the most specific organ to be affected because of hypertension is kidney. Heart is also affected by hypertension, but it is also heart disease can also be related with many other comorbidities. But chronic hypertension is the single entity by which you can, in most cases, you can narrow down the diagnosis related to renal system. So also the history favoring the involvement of renal system is fatigue. Since the patient has fatigue, he might be having anemia. So you would have known that chronic disease can lead to anemia, that is called as anemia of chronic disease. So we'll discuss it in a separate video. And also she has vomiting. It can be due to accumulation of certain unwanted metabolites in our body, for example urea or ammonia, like that. And after narrowing down to renal system, we should look into the investigations, and these are the RFT findings. Urea is elevated. It is drastically elevated. In fact, it is 375 mg per deciliter. Creatinine is 22 milligram per deciliter, and hemoglobin is 6.1 gram per deciliter. And from this, we can come to the point that kidney is involved. And this is nothing but the uremic frost. Uremic frost is due to increased amount of urea in the sweat. So patients with chronic kidney disease and the patient who is on acute on chronic renal failure can develop uremia, which is excreted more in the sweat. And when this sweat dries, it leads to the formation of crystals, as you can see in this image. These white crystals are nothing but uremic frost, uremic crystals. And this happens when the urea level exceeds 200 mg per deciliter, and also it is due to late stage renal failure. That is nothing but chronic kidney disease. This can also occur in acute attacks during chronic kidney disease. We say it as acute on chronic kidney disease or acute on chronic renal failure. So this is a serious condition. It can lead to cardiac arrest as urea is elevated. You would have known that uremia can lead to various conditions like acidosis, uremic pericarditis, uremic cardiomyopathy. So this is a very serious condition. You should order immediately. You should look for ECG because uremia can lead to hyperkalemia. So you should be knowing to diagnose hyperkalemia with the ECG, which shows tall T waves. So something which shows tall T waves, we should always rule out hyperkalemia, because hyperkalemia is a very medical emergency which can lead to cardiac arrhythmias and sudden cardiac arrest. So calcium infusion of IV calcium gluconate can save the life of the patient. So uremia is that much dangerous. It can lead to hyperkalemia. And then these are the indications for urgent hemolysis. You can remember it in this way: AEIOU. A for acidosis, E for electrolyte imbalances, I for ingestion or overdose of the drugs like isoniazid, salicylate, theophylline, and uremia. You can take a screenshot of this. And then cardiac overload, which is nothing but cardiac failure and uremia. These are the indications for urgent hemodialysis. So this is a case of uremic frost due to increased urea levels, which is in turn due to chronic renal failure. Thank you.